And we have, as I explained earlier, this very odd, strange vaginal secretion, which can mean that a lot of ladies will come and see me in a GU clinic, an STI clinic, those terrible places at the back of hospitals where you think you may have got an STI. And other women may think they've got cancer because they have a horrible yellow discharge. We need to know more about it. The sore, smelly, burning, embarrassing, fearful things that can actually happen. Now, of course, if you do need some help, mostly we try and do it ourselves. So what do most women do when everything's going wrong down below? They go to the chemist and they buy some antifungal treatment and they pop some cream on. And in fact, that can sensitize the skin and make a bad situation an awful lot worse. I talked about the ballooning of the vaginal walls and the descent and the dragging sensation down below, and this awful business of difficulty holding on with the waterworks and the slight leaking and having to go very often and needing to go frequently and getting up at night. Now, urinary incontinence does increase with age, but at some stage, 1 in 2 of us will have some degree of urinary incontinence, and it can be youngsters, and it certainly happens much more as we get older. And in fact, we know that after hysterectomy, there's a higher rate. But one of the things that I am very moved by is if you look in a pharmacist, the number of women who have long since stopped having periods, who are looking at all the sanitary protection and working out which pads to buy and whether they can actually use something without having to call in the incontinence nurse because they don't really want to have to do that. And it's about 65% of elderly ladies in nursing homes who will be incontinent. So you need to ask, perhaps not yourselves, but definitely your friends and your relatives, do you pad up and put up? Because that situation is not good enough, and there are things that we can all do to try and help. We know we can use estrogen to help down below, and that we don't necessarily need to use it as whole body HRT. We can use it as local treatments. We can use it, and it's not absorbed into the body. So as far as we're aware, and most of us are fairly confident, this business of whether there are risks involved really does not apply to using courses of treatment, either tiny little vaginal tablets or vaginal creams, when we're using them vaginally to help with the pelvic floor. But in fact, interestingly, up to 1/4 of women who are still using full body HRT will still be having symptoms down below and may need some help there as well. So it is available in lots of different forms, and very little of it's absorbed, and it is, for the symptoms down below, probably better than using whole body HRT. So it's one thing I would encourage anyone out here who has either themselves or any friends or relatives to go and talk to their doctor or nurse about that kind of thing. There are also non-hormonal things, vaginal re-moisturizers, which help actually to get literally to get water back into the vaginal tissues and can help tremendously. And there are also some things that we can all do to help us with our wonderful little pelvic floor exercises, which I know we all religiously do while standing at the bus stop. I still remember being taught to do that. And pull funny faces. Now, I don't know if any of you have met one of these things, but this is a pelvic floor toning system or a pelvic floor educator. And these are little things that you pop inside the vagina, you'll be pleased to know, and you squeeze on the little ball, and when you're doing it properly, its little tail wags to tell you. I knew you'd all love that. There's a picture of it in use. Marvellous. And of course, finally, we can have, as the years go on, a loss of sexual desire with all of this happening, a loss of intimacy. Because, of course, women, hormonally, as I said earlier, are very complex beings. And we have all kinds of little tweaky buttons which get affected by time and age and our hormonal changes. But never let it be said that men are not just as complex as we are. Here they are. So communication is the key, and that's the message we're leaving you with today. Talk. Talk amongst yourselves, talk to your partners, talk to your husbands, talk to your doctors and nurses. You do not need, no one needs to suffer in silence. There are plenty of very informative websites out there which are very, very useful, and I would recommend to you menopausematters.co.uk. This is run by another clinician like myself. There are women's forums and chat rooms on it. There's a massive amount of information, and the Daisy Network, as I mentioned before. Now, I don't want to leave you thinking that I have painted this appalling picture of us all becoming this grotesque old woman by Matisse. She's hanging in the National Gallery in London. But I have to leave you with the message that I know when I see ladies as they're getting older, that locked inside every single one of us, whatever we may look like on the outside, is still this girl. And it's her needs that we still need to address. Thank you.